Hello, my name is John Howard. I'm a junior nursing student at OHSU. Together with my fellow classmates, Kelsey Johnson and Kimberly MacArthur, we conducted extensive research on the health needs of the Hispanic population living in Klamath County. The Oregon Health and Science University School of Nursing, Klamath Falls campus, in partnership with the Klamath Regional Health Equity Coalition and the Klamath County Health Department, conducted a focused community assessment of the Hispanic population living within Klamath County. The focus was to assess the health and well-being of the Hispanic community by discovering their inequalities, barriers, and resources. The following presentation is our findings. As of 2015, there are 7,000 Hispanic or Latino people, not including migrant or seasonal workers, in Klamath County. Identifying the health practices for the Hispanic population is useful in establishing services and programs to help improve their health. This provides the community with different needs of this population. In 2013, it was surveyed that about 86% of the Hispanic population in the U.S. were covered by health insurance, but this number is based on full-time workers and does not include farm workers. For farm workers, it is more difficult to access health insurance, which makes it less likely that they are going to seek medical attention because of the cost of paying out of pocket. This Hispanic population is more likely to use self-treatments that are low cost and do not cause an interference with their ability to work. They also tend to wait until their health interferes with their work to seek medical attention. Socioeconomic status and education levels are two factors that influence the health of the Hispanic community. With low income and language difficulties, this often impacts the ability to access health insurance. Along with access to health insurance, another factor that contributes to the barriers of medical care for the Hispanic population is transportation. Since transportation is a barrier in the Hispanic community, it makes it more difficult for them to make it to any health care appointments. With the fluctuating Hispanic population in Klamath County, as a result of the influx of migrant and seasonal farm workers, this population is one of the most underserved populations in the United States. The information contained in this report was collected from the Hispanic residents and working professionals who work directly with the Hispanic population of Klamath County. The data was gathered from 3 focus groups and 4 key informant interviews. Secondary data was collected through online database research and several government websites. The guiding themes for collecting this data are as follows. What is a healthy community? What are the barriers to health in Klamath County? And what are the resources needed to improve the overall health of the Hispanic community in Klamath County? This community report involved multiple steps for data gathering. Primary data was collected from 3 focus groups and 4 key informant interviews. Secondary data was collected to obtain background knowledge of the Hispanic community in Klamath County. The overall goal of the focus groups was to provide Klamath Regional Health Equity Coalition with the information needed to improve the quality of life and health for the Hispanic people in Klamath County. The purpose of the focus groups was to gain first-hand insight into the overall health, the resources that are available, and the barriers that are present in the Hispanic community of Klamath County. Members of a predominantly Hispanic church in Merrill participated in the first focus group. The second focus group consisted of several bilingual employees of Klamath Open Door Family Practice, who work closely with the Hispanic population on a daily basis. The Oregon Child Development Coalition, working with migrant and seasonal Hispanic farm workers, hosted a small group of parents and their children for the third focus group. When asked what encourages the Hispanic community to be healthy, a response was, "Our kids are what motivate us to be healthy." As previously stated, we also conducted 4 key informant interviews that provided information regarding the health and resources that are available to the Klamath County Hispanic population. The first interview was with an employee of Women, Infants, and Children, who is also an active member of the Hispanic community. An interview with the acting county director at Oregon Child Development Coalition, who works with migrant farm workers and their children to provide services and family support, was conducted as our second interview. The third interview was with the principal of a local elementary school, who services a large number of children from the Hispanic population. The final interview was with bilingual employees of Klamath County Developmental Disability Services, who work with several Hispanic families to provide resources for services in the community. After conducting key informant interviews, several common statements were made. Working with the Hispanic community is a privilege. They are all willing to help anybody in this community, as it is their passion and their heart. During our time working with the Hispanic population in Klamath County, we were able to effectively determine what the current needs are of this marginalized population. The goal in gathering data from these community outlets was to identify recurring themes so that we might prioritize what areas need the most immediate attention. Our findings are as follows: a need for quality bilingual communication and information, access to healthcare, which includes insurance, transportation, bilingual providers, information on preventative health, navigating the medical and government systems, after-school programs and resources for youth, and access to quality food. The findings were presented to the Klamath Regional Health Equity Coalition, as well as community members. 3 community presentations were provided. The presentation, conducted in Malin, Oregon, had Spanish-speaking translators present. A private presentation was given to a predominantly Hispanic church in Merrill, and the final presentation was held in Klamath Falls at the Oregon Institute of Technology campus. Since transportation is one of the highest priorities of need for the Hispanic community, especially in the outlying and rural areas, public transportation is a need that they would like to see met. This is a need that, if met, would also provide them with an ability and the encouragement to meet their other needs, such as accessing healthcare and healthier food. With a lack of access to healthier food options, the Hispanic community in Merrill and Malin voiced an interest in having a community garden where they could grow their own fruits and vegetables. Developing a community garden would provide this community with a stronger sense of community and belonging as well. Starting a farmer's market in this rural location would also be a tremendous asset for the Hispanic community. There is a break in communication between the community agencies as a whole and the Hispanic community. Developing a network where all of these agencies can collaborate with each other and share resources to create equitable access to those community resources is the first step. This collaboration could lead to a central place where resources can be located and provide the community with a way to easily access them. An additional area of need that the Hispanic community has voiced an interest in, especially in the rural communities of Malin and Merrill, is the need for more after-school activities and programs for the children. An open gym where the kids could play indoors and have organized team sports such as basketball would positively impact the overall health of these communities. For example, the city schools in Klamath Falls currently offer an after-school program that provides students with opportunities to play sports as well as help them with their homework, and it also provides a free dinner. What does it mean to be a healthy community? It is recognized that there is work to be done in moving towards an equitable community, and that is a shared responsibility. Everyone has a role to play in ensuring the success of our community. This Hispanic demographic holds about 10%, sometimes more with the influx of migrant farm workers of Klamath County's population. Throughout this assessment, we felt the gratitude of asking these questions and came to understand the Hispanic people's readiness for action. Starting by building on this community's already strong resources and appreciating the magnitude of the barriers they face, can improve health outcomes and minimize frustrations while activating the plan for an equitable community. To ensure sustainability of equity of resources while maintaining a symbiotic relationship with the Hispanic community, small initial steps should be made. We asked, what does it mean to be a healthy community? The Hispanic community recognized this assessment as the beginning of change and voiced their readiness for action. We would like to offer our deep appreciation to the Hispanic community and the community partners for taking the time to meet with us. This project would not have been possible without their open-hearted participation and all of their contributions. The relationships established during this project have made a lasting impact on us all. Thank you for taking the time to listen to our presentation.